Dear people of Ghana, once again, it's time for us to go to the schools and administer some drugs to mitigate the effects of one of the major items of the neglected tropical diseases, bilharzia. The medical name is Schistosomiasis, very big name. For many of us, we know it as blood in urination, even for boys and girls. In the whole wide world, there are about 251.4 million people affected by this neglected tropical disease called bilharzia. In Ghana, it affects about 7.6 to 7.8 million children between the ages of 5 and 14. A very vulnerable age group. You will not believe it, but almost all our 261 districts have issues with this disease. We call it endemic, which means that it's prevalent. Unfortunately, in a lot of communities, people think that it is normal for boys to also urinate blood, almost as if they are also menstruating. It is not normal at all. We should consider both boys and girls to be equally vulnerable. When children are suffering from bilharzia, they can't be attentive in class, and learning becomes very difficult. And sometimes we think that is because our children are not intelligent. Far from it. They are very intelligent. But bilharzia has a way of affecting their level of attention. They are always, feeling unwell and so on. We need to get rid of this. We don't want our children to grow up already diseased and affected by something that we can easily get rid of. And that's why the Ghana Health Service, in collaboration with the Ghana Education Service, go around the schools at a certain period and administer drugs. This year, the medication is going to be administered to 3.5 million children between the ages of 5 to 14 in about 116 districts. Don't be left out. Parents think that these drugs are not safe. I can assure you that they are very safe. If you're a parent, please love your child enough to want the best for your child. Let them take their medication. People say that it has side effects like dizziness and nausea. The side effects are so minimal. And there are always health officials there to handle these very minimal side effects. If we want to avoid the side effects, what we need to do is to make sure that our children eat before they receive the medication. I've taken some of the medication myself. I've been to schools. These children have taken the medicines and they are fine. Make it a point to get your child to take the medication. We're doing this so that all of us will be a part of ensuring that our children are safe, they are healthy, and we can avoid them getting diseases that are treatable. I know you will do your part because I am determined to do my part. Thank you very much for listening.